All right.
Hi.
We promised you guys a video, a couple weeks ago maybe? And it was like a couple days. But it is a very late video. We never do videos this late. It's almost dark. What is it, like 7, 8 p.m.?
I guess so. I don't really even know.
And the weather. What was it going to... It was supposed to be 95 degrees.
I think it got up to 95. It's now like 92.
Yeah, it's already started to lower. And the low tonight, this is a pretty big, drastic change between the high and the low is...
68.
68 degrees Fahrenheit.
Yay.
Woo! So how have you been?
Tired.
Stressed?
Stressed, nervous, anxious, tired, all of it.
Yeah, the household has been absolutely mad. And by household, I guess I would say the kids have caused chaos and disruption. Would you say bad behavior? Haven't quite learned how to listen and to do their chores and stuff, or have they?
Yeah.
Are we all learning, or are we just trying to make them learn what our expectations are?
I don't really know.
So, what's this video about?
My eyes.
So she did just a little bit of a short, didn't you? Like a minute or 2 minutes a couple weeks ago. Right after she had an eye procedure, and you can see, like, if you look back on one of the last videos she did, it has a big red spot on her eye. And we do need to correct something that we said. You said it went right into your eyeball, the needle.
Didn't go in my eyeball, but it felt like it was going to my eyeball.
They are super close. It is super close to your eyeball, those eye muscles. And I looked at some procedures on YouTube, and they do have a couple of them, and a few other videos that explain everything. And they even have the surgery that you would most likely be having if you decide to have the surgery.
But if you look all the way to like the left, and when you do that, they go in the corner, and then all the way to the right, and they go in the corner. So again, it's not in the eyeball, but I don't know how to explain it.
When I looked at the procedure, I seen the person's, I think a woman, but I'm not sure, her eyeball moving. So I said, there's no way that needle is in her eyeball when it's moving, but it looks almost like it's in the eyeball.
Yeah.
It is that close.
When he's coming at you, it's like that. Oh.
So what was that procedure like?
It was very scary.
Painful?
Somewhat, only like my right eye didn't numb up. So I felt the needle and I jumped. I literally almost jumped out of the chair. But they didn't even numb me.
He sent me out of the room. I thought, well, this is just a little tiny procedure.
Yeah, like, first of all, let's back up. Okay. You get in the office, and the nurse or whatever, tech or whatever he was, like, you get out of the chair. I was like, not on my own, but if I have to, he'll move me, so... They put me in, like, the procedure chair. Well, I'm, like, a tone kicked in, and I was, like, falling out of the chair, so right off, I felt really uncomfortable.
And, yeah, we asked them if they could put a seatbelt or had any way to strap her in this chair. And, I'll get back with you in a few minutes. Oh, nope, there's no way. Can you just get in that chair?
Yeah, so like I did tell the actual doctor that my chair tilts, and I think next time I will definitely do that because I don't want to be in a procedure chair. Like, I was so uncomfortable, and that just made it like 10 times worse. And then the doctor comes in and asks Dan to leave. And now I'm like sweating bullets. Like, I was pretty, intense.
Yeah.
So it was quick, easy. I won't say it's painless, but it was fairly easy. It took like 10, 15 minutes. And then I walked out. My right eye was sore, and my left eye was completely bloodshot, and I couldn't see. And very uncomfortable. Like, he told me, oh, you'd feel discomfort for maybe an hour. No, I feel no it.
And here's the thing: when we first had our, what is it when you see them for the first time? What's it called? Where they talk about what your options are, appointment. What is the word they use?
A consultation.
Consultation. There we go. Thank you. So when he first had the consultation, he said, "Well, we don't want to puncture a blood vessel or whatever. It'll take a month to heal." Then we get into the operating room, and he punctures the blood vessel. Was it left eye, right?
The left eye, yeah.
And he told her, "Oh, it'll be a week. It'll heal in a week." So it went from a month, and we were both here. We know this guy's whatever, full of shit. Let's just say it. You've never heard me say that on this channel, but he's full of doo-doo.
I was fine with him. Dan is always like,
I catch these little things, and he says a month, and then it happened. It'll be a week. But what kind of problems did you have, if any, afterwards?
a lot of discomfort, just kind of like, I guess you would say eye aches and light sensitive, which I'm light sensitive anyhow, but it increased it.
And the drops that they give you.
And they give you an antibiotic drop that you do 4 times a day, which I did, but my eyes, I'm not sure if it was eye allergy because they still sometimes itch, but like, they itched pretty bad. And like,
again, that was supposed to last a week only. And
like the first few hours, they felt really gritty.
And you used it for 2 weeks probably, right?
Mm-hmm.
Or somewhere along that. So you had to use it more than a week to try to get your eyes to stop itching. So that was a big issue. You had eye itching. Was it pain or just itchiness or kind of burning? What was it, a combination of, or just itching?
Just itching.
And I think you told me it felt like something was in your eye. What, like a hair or something that's just like stuck in there?
Yeah, like I can feel it on my right eye, but I think that had to do with him poking the needle and not being fully numb. Like, it felt like,
Maybe the needle scratched another part when you jerked back or something?
yeah, like it felt like something poking me constantly. But overall, it was okay. It wasn't horrible. I'd be willing to do it again, however.
Well, did it help you, right? That's the question.
Not really. But according to when we saw him, he said that he would start off.
Okay, there's the famous yawns you guys always see. And it doesn't have to be late in the day to get that yawn. It can be.
He said that
early.
we'd start off with the minimum dose of botox. So he said don't expect like much of a difference, which very, very, very minutely, is that even a word?
Minute
Like,
is a word. I
I
would assume
see
so.
I can catch words a little bit easier when I'm trying to read, although the ice shake is still horrible.
Sorry, we got dogs and kids here, but still messing up our videos.
So we emailed him and told him all this. And his reply was, well, if it didn't work, then our next step is to discuss surgery, which we will do on your next visit. Which, yeah, totally freaked the living crap out of me because...
And let's stop here because you're going to say that I catch things, and I asked him questions, before that, if the Botox works, the surgery's more likely to work. That's what I get that he's told us. But what if the Botox doesn't work? Why is he pushing for surgery so fast with one attempt and such a small dose of Botox? Why doesn't he try once or twice more with a higher dose?
But, like Mom said, as far as this emailing back and forth, I'm just a name and a number, so he may not.
Okay, we gotta stop for a second. And we're back. We warned you several videos ago that we had kids home, homeschool, PP, whatever, and this kind of stuff would happen.
Wow.
Some things get cut, some things will be left. Okay, so where were we? Your mama said...
As I was saying, Mom said...
Your mother.
As far as the emailing him and him saying that, all... Like, does he really know who I am? Like... Or am I just another patient that he is corresponding through via email? Like,
money. Surgery equals more money. That's what I'm thinking.
I don't know. We'll see. I'm nervous as crap because my appointment is Thursday. So, I don't know.
Are you more nervous that he's going to talk you into it maybe when you're not comfortable with it yet? Or are you dead set on the surgery?
I don't know.
Because if you're on the fence, he's probably going to try to talk you into it. Do you think you can talk him out of that and try to say, let's try a higher dose of Botox first?
I think that's what I am going to say. I mean, I don't have a problem with it. That's what he told me the first time.
And, I don't know. I'm just playing out scenarios in my head. I think if he tries to push you without, giving it a better shot, and if it's not what you want to do, he may hear some stuff from me. And I'm not the type of person that would confront a doctor or something like that. You probably would be. I've seen some stuff in the ERs and stuff, right?
I don't think I need to confront him, but I just would like to give it another opportunity and give me more Botox before you go cutting into my eyeballs.
Exactly. He seems to be speeding, 1,000 miles an hour toward that direction after one attempt.
Again, but how do we know that he even knows who he's talking to?
Well, he's going to know next time. He's
He'll know when you're in person, yeah, but I'm saying, like, all we were was corresponding through email.
Yeah. So
I don't know.
All right, so you watched one or two of the videos of the actual surgery, didn't you? What did you think of the surgery itself? And it looks like there's at least two types of surgery. They're very similar. One, they put a thread or something in your eyes that they can adjust later on, and that wouldn't be for you most likely.
It's called adjustable sutures. Yeah, I don't think that would pertain to me because
that's for people with like crossed eyes and stuff, right?
Right.
But that's not you. So hopefully you wouldn't have sutures in your eyes.
Yeah. So I don't think I need that one, but I don't know, maybe I do need that one, but I don't think so because, and I think that's to straighten all out. So
yeah, I mean, it wouldn't make no sense. Your eyes aren't crossed.
I mean,
jeez. Here we go. Maybe we shouldn't do a late night one anymore. Wow.
It was scary.
The good thing
very
is,
scary.
The good thing's you're asleep for it. You don't know anything.
Yeah, I'm a little bit worried about the aftermath because everyone again said, "Oh, it's no big deal. You have a little bit of discomfort," but that scares me because I was supposed to have an hour of discomfort the last time.
Yeah, they always seem to.
So do they
underestimate your?
Yeah.
And that happens with everything. That happens with neck surgery, back surgery. You know, you're up in a week or a month, but you're really not.
Yeah, the one doctor would say you cried tears of blood afterwards for like a week, and that's a little bit freaky.
Yeah.
But I don't know. Just wait and see. Like,
so
it's more of like I just want to know that something that's gonna work. Like even that you're like shaking like a leaf, and that's like beyond.
And we don't know. We know. Remember, we did an alcohol video, and it makes the eyes shake extremely slow, so you can actually focus long enough to read, words or see pictures or people.
Yeah.
And the doctor said 100% of ataxia patients get some sort of benefit from alcohol, whether it's their eyes or the way they move or walk if they're walking. So I don't know. What else do we need to say?
We'll see. I guess that was it. Like
the appointment is, of course, I don't know when this is going to be uploaded. It might, because our internet has been really messed up lately. It could be after the appointment before this gets uploaded. I'm not sure, but Thursday, August, still in August, right? Today's the 26th.
August 28th.
August 28th.
Pray for me.
Hopefully we don't have the next video out before this one comes up.
Yeah, that would suck.
Yeah, that's not going to happen because we'll upload them and release them in order either way. So I guess that's it. Anything else you want to talk about?
Like this video, subscribe to our channel.
All right, take care, guys.
Bye.
Bye.